Hello, I'm Dr. Christian Augustin with Bayside Chiropractic and Rehab. And today, for our topic, we're going to actually talk about pregnancy and the effects of pregnancy and obviously back pain during pregnancy and what you can do about it. First of all, about 2/3 of all pregnant women experience some form of back pain. And it can start as early as the first trimester. When that happens, obviously, not only does it cause a great amount of stress for the pregnant female, but it also causes her activities and stuff to have to change, which in turn causes more stress. So stress is not exactly good for the mom or the baby. So what exactly happens during pregnancy? So we have a couple of things happening. First of all, later in the pregnancy, when you develop your belly, it changes your center of gravity, which means you start having to arch your back, and which causes a lot of strain on the lower back. Which, the lower the pregnancy is, probably the more the strain's going to be just because of gravity. There's also hormone changes that occur. So we have hormones like relaxin and certain hormones that relax the ligaments so that you can give birth, so the canal widens and the joints open up and you can give birth. Well, this isn't a perfect system, and sometimes joints don't cooperate as much, and certain joints are more, let's put it, stuck or harder to relax. So this can cause problems with lower back pain. Another thing that happens is for smaller females and females that have twins or later pregnancies, you have something known as diastasis recti that can occur, which is basically a separation of the abdominal muscles right in the center. So you get like a gap, which is almost like a hernia, but a really long one. So if we catch this early enough, and even afterwards, there's certain taping techniques we can use and certain treatments that we can do to prevent that gap from widening and being, more of a problem after the birth. And even afterwards, I just finished with a patient that gave birth a year ago, and we did some deep tissue massage. We did some taping, which is kinesio taping to hold the tissues together, and some laser, and it actually corrected itself. So we've done well with diastasis recti. And obviously poor posture. Poor posture because of the weight of the baby, where it's positioned, how low it is, and how big it is. So these are the things that can lead to lower back pain and other things like diastasis recti. So what can you do to minimize back pain? Well, the first thing is you can keep your core strong. Simple exercises like planking or things to keep your abdominal muscles tight will relieve pressure on the lower back. Those abdominal muscles will support your low back instead of the low back taking all the weight. Use proper body mechanics. I don't know how many CrossFitters are out there, but in CrossFit you learn how to lift properly, brace yourself, all these different things. And using those proper mechanics will prevent, especially injury to the low back during pregnancy. Another thing that we can do is we can support the belly. There's support belts that we can use. And also the way you sleep, which we don't suggest you sleep on your back. I know there's back sleepers that can't help it, but if you can sleep on your side, first of all, the weight of the pregnancy, you might have, shortness of breath if you try to sleep on your back, just because of the way it pushes up into your diaphragm, and there can be other problems. And then obviously poor posture and stress reduction. Meditation, anything you can do, decreasing your pain, will help make you happier and help make you feel better during your pregnancy. Another thing you could do, a lot of people have problems with swelling or increased fluid retention in their lower extremity, ankles, feet. You can wear compression socks. You can stay as active as possible. Walking is great. It'll keep those muscles pumping those fluids back to the heart where they belong. Using body pillows to lay on your side to get more comfortable. Elevating the feet, especially if you're experiencing swelling or swelling or back pain. Elevate the feet and get the compression off the back, get the weight off the back. And proper body mechanics, like I said again. You can also apply ice or heat. Usually if it's acute, I would probably start with ice. You can use a contrast therapy where you do ice, heat, and you go back and forth. So if you start with ice, which I recommend, I always suggest you end with ice during a contrast therapy. And all that contrast means is you use both and you alternate. Now, people are going to ask, is chiropractic safe for pregnant women? Well, it's probably one of the most safest treatments during pregnancy. Most OBGYNs won't prescribe you anti-inflammatories and different things for back pain because it can get into the baby's system, cross the placenta. There's certain techniques we use. One that's very effective that we use here is called Weber's technique. It's very effective for babies that are out of position too. An example, third trimester breech. We use a special type of technique which is really, really low force, like very gentle. And there's a lot of success with getting breeches to turn before the pregnancy. And a lot of OBGYNs actually know about it and refer out for that technique prior to doing a cesarean section. Then we have regular manipulation, which keeps the joint moving. And how I look at this is if the joint's stuck or the baby's in an uncomfortable position, he's going to move. He's going to get into a more comfortable position for him. So if that applies more pressure to your back, well, he's okay with that. So sometimes just adjusting will get the baby shifted into a more comfortable position for the mom and a more appropriate position. And then obviously we can talk nutrition, nausea, all kinds of other things. We can help with your immune system during pregnancy because a lot of times adjusting will make you feel better, decrease the stress, which will help your immune system in the long run, especially keeping down the cortisol levels, which adds, can decrease your immune system over time. So if you have any questions, please don't hesitate to contact me. My number is 990-8388. If you're pregnant, planning on being pregnant, or experiencing pain from pregnant, don't hesitate to contact the office. Again, my name is Christian Augustin with Bayside Chiropractic. And again, the number is 251-990-8388. Thank you.